Hello, everyone. This is Yusuf Asiri. Today, I will be presenting our paper, which is titled Expert Review on the Use of Social Media to Study the Relationship Between Digital Empathy and Well-Being Issues in the context of Saudi Arabia. We are a couple of researchers from Najran University in the College of Computer Science and Information System in Saudi Arabia. Dr. Yusuf Asiri, who is talking to you now, and Dr. Turki Al-Aliani, and Dr. Abdul Majid Al-Qahtani. So today I will be giving you a brief description about our study and why it's important. Also, I will be talking about what empathy actually is and also how that is connected and related to well empathy. And we will be focusing on these behaviors, especially in the social media platforms. Also, I'll be talking about social media in Saudi Arabia and how that is actually growing really fast. And there are so many users from Saudi Arabia using these kind of platforms to communicate with others and share their ideas and their emotions, and that's the most important part in this study. I will be also talking about the methodology of this research, giving you an idea about what kind of tools and techniques we used in order to gain some participants and some results from this study. However, this study is kind of a work in progress. Still, we are working on the analysis of the interviews we conducted, but I will try to give you some of the initial findings and some of the initial insights that we gained so far. I will be also talking about the conclusions and our plans actually for the next stage and what kind of work that we are looking for in the future. Also, as any other research, there are of course some limitations. I will try to briefly talk about them and how we are planning to avoid them in the future. Lastly, I will present some of the references we actually used in our paper. So, as we all know, there is a global interest in studying the impact of emotional content in social media. And that's actually started from the recent years. As we all have noticed, social media becoming the place for everyone, not only to share ideas and thoughts and experiences, but also to share some of the personal stories. And that's also actually involved some of the negative and positive experiences. We wanted to know how people are interacting with each other in social media in terms of their emotions, how they actually accept each other, how these kind of interaction between each other affect the well-being for those users. When we started doing our research, we unfortunately noticed that there is a little attention has been given to the influence of empathy in social media users in terms of their well-being, especially in the Arab world. Uh, One of the initial thoughts that we found about the reasons why people, or in general, why empathy and well-being is not in a good relationship with social media platforms. One of the idea was that we have, of course, less facial communication with other. There is no face-to-face interaction between each other. That's providing us a little about other people and what kind of experiences they are going through. Another reason is that emotions in general are very sensitive issues, especially in the Arab world. So that could be another reason why um, the experiencing using some personal context to share with others could be a very sensitive issue. Um, but that was the start for this research. We wanted to look at what kind of things that people are fine to share with other peoples in terms of their emotion, what kind of response they are getting from other people or from other users. Are there any actual differences of those kind of responses they are getting from other people? Are they actually affecting those people in terms of their well-being? So we wanted to look at these kind of emotions directly from the users. But we couldn't find enough research and literature review about this. But so we decided to discover this by approaching some experts, whether they are in social media, whether they are from different fields, some like social experts, from psychiatry, from psychology, people who are so active in social media. So we decided to interview them to gain more insights and more ideas about how they actually are interacting with other people, how they observe the interaction that's happening with people in terms of their emotions. So let's start by talking about empathy. Empathy is actually defined as the ability to experience what others are experiencing through understanding their feelings and thoughts. Well-being can be identified also by the factors that make someone satisfied, happy, and comfortable. The findings actually indicate that there is a strong relationship between these two concepts, between empathy and well-being. That's involved actually the culture, the power, also the gender. Social media, as we all know, is kind of different platforms that allow people to interact with each other, share their personal experiences, feelings, and also their social life. So social media can involve negative experiences, and that's the most important thing because it's going to affect the well-being. There are actually, based on the research in the global context, there is some of the negative experiences like hateful messages, lack of empathy, racist comments, cyberbullying responses. These are affecting every single person, especially young people. So we can say that the lack of research to date regarding the use of social media and boosting empathy and well-being in the Arab context actually drive us to explore more this area and how we can do about it. Social media in Saudi Arabia, currently Saudi Arabia has a total population of 34 million, so 25 million of them are considered to be active social media users. There are so many research about the techniques and the tools that have been developed to detect some of the emotional terms, but unfortunately, there is no study that focus actually on understanding the effect of certain feelings. Most of them are considered to be a very technical studies, and that's very good. But also, we wanted to look at the social aspect of this and how we can conclude some findings from that. A current study have only focused on, as I said, examining empathy in the physical, also physical environment, workplaces, so schools, hospitals, but we don't have any research so far about studying empathy in social media specifically. So the context of this research, there are a number of Saudi experts have been interviewed from, as I said, psychology, social media experts, psychiatry, social psychology, psychoanalysis, psychotherapy. All of them have helped us to get an insight into the main issues related to empathy and well-being and how those concepts are connected and relevant to each other when it comes to social media users. So we believe this study is very important for a number of reasons. The first reason is we want to get an understanding of how Saudi users' empathy and well-being are affected through social media use. The importance of this study is also to show how users, educators, policymakers, and designers should consider an empathetic social media platforms. Um, we want to inform those actors to come up with a solution for more social solidarity, kindness, and empathy for better well-being. Rather than just relying entirely on the technical issues by blocking negative or hateful messages or comments that we see daily in social media. Emotional areas could be also more uh, clearly and freely without a cultural or social constraints for people to interact with each other and to express themselves very freely. Methodology, as I said, we interviewed a number of experts. There are almost 15 experts, and they have helped us a lot to explore this area uh, because if we started by exploring this idea by implementing some technical tools and trying to use them, this could be leading us to a lack of understanding and what the actual effect of empathy and well-being in social media. We use email invitation to ask them. They helped us a lot to conduct our study. We focus, as I said, in the professionals one, so we can understand more actually about the underlying concepts of how social media is affecting everyone's well-being and empathy. They were from Saudi public and private hospitals and university. As you see, there are so many of them, different ages, different genders, different jobs, different sectors, and different experiences. And some of them are holding PhD, and some of them are masters, and some of them are professional workers. So the methodology, as I said, we focused on the demographics of them as skills and self-perceptions. We focused also on the working styles and social media. And lastly, we focused on the empathy and well-being and how the participants are seeing those concepts and these behaviors and the use of social media. We use Skype and telephone to interview them for almost 60 minutes. So the initial results and findings are very promising, and we can see that they are observing negative experiences with some of the users they are following or they are consulting, and that could be a reason for why this study is very important. We will be looking at these interviews more closely and deeply to analyze the current qualitative data. We will be applying existing frameworks and models from social science and psychology in order to study empathy in different settings, such as workplaces, households, and early childhood. We'll be also exploring more to better understand areas where technology can be designed to promote empathy and well-being. There are, of course, some limitations we are aware of, something like the sampling bias, the number of participants, and also there could be a limited sampling of males and females among the participants. The conclusion, we can conclude that there is a lack of research in the Arab world regarding empathy and well-being where social media is involved. Um, Also, in terms of the experts, we can conclude that we have a better understanding of how experts now evaluate the level of empathy and well-being and how they are communicating with each other in social media. From the users, we can say social media is a good place and good area for social solidarity, kindness, and empathy, and for better well-being. Of course, we will be also in the future looking at some of the sentimental analysis tools and techniques. This will require a text-based analysis for real posts from Twitter or from Facebook to show the effect of social media on empathy and well-being in different scenarios where culture, as I said, gender and local trends are involved. Here is some of the references. I hope I gave you a very clear idea about our research. And now we are happy to receive your questions if you have any questions. Thank you so much.